I'm entering my patient's room. I'm going to perform hand hygiene. I'm going to check for any isolation precautions or fall risk precautions. Patient is on standard precautions. I'm going to check for environmental hazards, make sure that there's nothing on the floor, any cords or anything that would increase the risk for a fall. Hi, my name is Sarah. I'm going to be your student nurse today. How are you?
Good.
Good. And what brings you in today?
Just here for a physical.
Okay. Can I just check your name
Suzanne Katz,
and your date of birth?
2/19/1976.
Okay, and are you in any pain today?
No.
Good. And on a scale of 0 to 10, 0 being no pain, 10 being the worst pain that you could imagine, where would you put yourself?
0.
Good, perfect. Patient is relaxed. Her facial expression appears calm. She is lying comfortable in bed in Fowler's position. Her skin color is white, consistent with race, and she appears to be healthy, not malnourished in any kind of way. Her speech is clear and fluent. Her hearing is intact, and she appears to be well-groomed with good hygiene. Do you know where we are today?
John Tower Hospital.
Good. And the date?
December 5th, 2016.
Perfect. And the president?
Donald Trump elect.
Okay. Patient is alert and oriented ×3. And if you can just put your hands up like this and push against me. Good. And pull. Perfect. And the same thing with your feet. You can push and pull. Good. Patient's upper and lower motor strength is strong and equal bilaterally. Her verbal response is intact. I'm just going to check your pupils. If you can look at the wall for me that way. Pupils are equal bilaterally. They are round and reactive and equal bilaterally. Sorry. There is no facial droop or ptosis noted. Her communication is clear and fluent. And can you swallow it for me? Perfect. Awesome. Patient is on room air, no supplemental oxygen needed, no incentive spirometer has been ordered. She appears to have non-labored breathing with a good respiratory effort. I'm just going to go ahead and listen to your lungs. Deep breath. And again. Okay, and if you can just lean forward for me. And again. And last time. Good. Lungs are clear, no adventitious sounds are heard. And if you could just cough, deep breathe and cough for me. Good. Cough sounds good and dry, no mucus is produced. Next, I'm going to listen to your heart. Going to listen at the apex first. Regular rhythm and rate at the apex. Next, I'm going to compare the apical with the radial pulse. Okay, and they are equal. Next, I'm going to listen to all the heart sounds. Start with the aortic. And pulmonic, tricuspid, and mitral. Okay, I'm going to repeat with the bell. The aortic, pulmonic, Bicuspid. And mitral. Good. All heart sounds are is regular rhythm, no murmurs heard. If you can just put your hands on them and check your capillary refill. Good. Rapid refill, less than 3 seconds. And I'm going to check your for pretibial edema. No edema noted. I'm going to check the posterior tibial pulse and the dorsalis pedis. And they are all regular, equal bilaterally. Patient does not have any IVs present. Her skin color is white, consistent with her race. It is warm and dry to touch, no moisture noted. I'm going to check your turgor, it's going to be a little pinch. Good. Turgor is good. Patient does not have any lesions noted, no dressings or skin breakdown is noted. Patient is at a low risk for skin breakdown due to the fact that she is ambulatory and good nutritional health, and her skin is intact and dry and warm. Next thing we're going to do is your abdomen. It is flat, and I'm just going to listen to your bowel sounds. Bowel sounds are present in all 4 quadrants. Next, I'm just going to do light palpation. Any pain?
No.
Good. Okay. No masses or tenderness is present. Patient does not have any drainage tubes. And when are you passing flatus or stool?
No.
And when was your last bowel movement?
This morning.
Awesome. Do you have any problem with your current diet? Any intolerances to any foods?
No.
Good. And are you voiding regularly?
Yes.
Okay. And what about the color of your urine?
So light yellow.
Perfect. And the clarity, is it cloudy or clear?
Clear.
Okay. Any odor?
No.
And the quantity is okay, normal? Okay. Perfect. Patient is not on bed rest. She is able to ambulate without assistance. She can get up and transfer to the chair if needed. She does not use any ambulatory aids such as walker, wheelchair, or crutches. She does not have any SCDs or TEDs, no foot pumps are noted. She is at a low fall risk due to the fact that she is not taking any narcotics, her vital signs are okay, and she ambulates without assistance. So I would lower the bed to the lowest position, make sure that the side rails are up, the brakes are locked, and she does not have a bed alarm that is ordered. I'll make sure that the call bell is within reach, and I'll perform hand hygiene and document my findings.